Greetings, everybody. I'm Caddo Parish Commissioner Mario Chavez. On behalf of the other commission members and Dr. Woodrow Wilson, thank you for all being here today. Thank you for the media, as always. We want to thank all of our media partners for being here today as we continue to share some of the promising news about working to fight this pandemic throughout Caddo Parish. I'd also like to thank the Louisiana Army National Guard for being here. I used to be in the Guard, so I like seeing all these soldiers here, and I like what you guys are doing. Thank you for coming out and helping us up here in Caddo Parish. We're excited to be able to officially announce the beginning of rapid results COVID-19 testing in medically underserved communities across the parish, beginning right here in the MLK community this Saturday. COVID-19 has affected many individuals and families in our area, and unfortunately have seen the effects of these disease across the parish. No neighborhood or region of our parish is immune, and that is why access to testing is so important. We've heard and seen that national and state guidance includes widespread testing as a critical component in tracking COVID-19 and moving all of us towards gradually reopening our economy and returning to some of our activities is very important. And so utilizing this mobile testing in our communities helps us do our part for the state and the nation. This partnership is due to the collaboration of Caddo Parish Commission, LSU Health Shreveport, and other community partners. The Commission strongly believes that access to medical resources during this time is so critical, and we are confident that our investment of $175,000 in this mobile testing is paramount to continuing to beat this pandemic. I'd also like to thank Commissioner Stephen Jackson for bringing this legislation to the committee for full consideration and his commitment to public health and working with the commission body to make this investment a reality. We are thankful to be working with some of the most brilliant doctors and workers in medicine right here in Caddo Parish. LSU Health Shreveport, thank you so much for everything that you have done. We know that the results that are able to be processed through the emerging viral threat lab will be instrumental to the work in learning more about COVID-19 and even in the creation of a vaccine. At this time, I'd like to introduce Dr. G.E. Galley, Chancellor of LSU Health Shreveport, who will speak more to the medical school's efforts and some more specifics on the mobile testing unit. Thank you.
Thank you, Commissioner Chavez. I want to thank everyone that's here today and everyone that's helped put this together. As the Chancellor of the LSU Health Sciences Center here in Shreveport, this is a very proud day for me. David Raines Clinic is a clinic that we've been looking forward to collaborating with for some time. I want to thank the Caddo Commission for helping facilitate this, all the commissioners, particularly Commissioner Chavez and Commissioner Jackson. I want to thank the National Guard. They've been tremendous in helping us already. We have a move that's going to happen this Monday. We're moving patients over from the Kings Highway location over to the old Shumpert property at St. Mary's campus in conjunction with Oshner LSU Health of North Louisiana. So thank you guys for all the hard work that the National Guard has done for us. Our EVT lab, the Emerging Viral Threat Lab, is going to be a real game changer, not just for Shreveport, not just for Caddo Parish, not just for Northwest Louisiana, but for the entire state and the entire region. This is a facility, a lab that is getting not just regional notoriety, but national and international notoriety. It's going to allow testing to be done, viral testing as well as antibody testing, and it's going to improve both qualitatively and quantitatively the access to care for the underserved folks in all of Louisiana and indeed the entire Arklatex. So I just want to thank everyone. I want to thank in particular Mr. Alan Organic, who was really one of the first individuals in our community to step forward. Alan, thank you so much, and provide some additional support in addition to the support that the Caddo Commission has provided us. Mr. Organic stepped forward and made a very generous donation to help support our lab, the efforts of our lab, the researchers, the mobile units that's going out, the additional people that we have to hire to help do this, the cost of the materials and everything that are involved. I can just want to thank you from the bottom of our heart. And again, thank you. Without further ado, I'm going to introduce Dr. Chris Kevel, who is my Vice Chancellor of Research and Dean of our graduate school at LSU Health Sciences Center. And he basically is the mastermind, along with folks that work with him, for the Emerging Viral Threat Lab and all the research that's associated. We currently have over 12 clinical trials that are COVID related that are being conducted in our Health Science Center as we currently speak. Dr. Kevel.
Good afternoon, everyone. Thank you, Dr. Ghali, for that introduction. And I'd also like to echo my appreciation and thanks to both the Caddo Parish Commission, as well as the State Guard, National Guard, as well as other local leaders, and more importantly, the David Raines Clinic here. As Dr. Ghali mentioned, we've had a history of working with many individuals in the community to bring healthcare and treatments to folks that may have difficulty actually coming to our facility. Dr. Ghali mentioned that this van that we have through our Partners in Wellness program will really be a game changer. It will allow us not only this Saturday to come to the David Raines facility, but it will allow us to go into many other communities. So just to give you an example of where this van will go, in April 28th, it's scheduled to go to Moortown. May 1st, it's scheduled to go to North Caddo. May 2nd, it's scheduled to go to the Cedar Grove, Sunset Acres area. And then on May 9th, it's scheduled to come back here again. So one of the things that I'd really like for all the citizens of Caddo Parish, as well as Shreveport Bossier, to understand is that there are many opportunities for you to be able to get tested, so that if you can't make this weekend, this Saturday, by all means, please check out the website of the Caddo Parish Commission, as well as the Emerging Viral Threat Lab, that will be able to provide you with a list of the future dates where you can come out and be tested. The other thing that I will tell everyone here is that because we have such a strong partnership with both David Raines and many of the other clinics and facilities in the state, all of this information is closely and safely guarded. So your medical information, all the information that you will provide, is completely private. No information is given out to anybody else. All of the test results will be reported to the physician that's in charge of your treatment and will be communicated to you directly. So that's a very important thing for everybody to realize, that they're definitely going to be taken well care of, and all their information is going to be safeguarded. The last thing I will say is that, again, this could not have been possible without multiple individuals, not only Dr. Ghali at our campus, but also other individuals throughout the state. Governor Edwards was really instrumental in allowing us to have executive orders where we could stand up this Emerging Viral Threat Laboratory within a matter of 10 days. And just to give you some perspective, for us to emerge out of this viral pandemic, we have to test, test, test. And right now, our Emerging Viral Threat Laboratory can handle up to about 1,500 tests a day. And we anticipate growing that by another 1,000 within another four weeks. So we really are quite thankful to the state, as well as everyone at LSU. And I will wrap up now, and I'm delighted to introduce to you the mayor of Shreveport, Mr. Adrian Perkins, who will share some words.
I want to thank Dr. Kevel for his relentless work in us fighting COVID-19. As he said, testing is so important for us to really overcome this virus and put the necessary precautions in place. And it's something that we should be very proud of, is that Shreveport per capita actually tests more than any other city in the state of Louisiana. And Louisiana per capita tests more than any other state in the entire country. So that's something that we should all be proud of. And I'd like to thank Chris and the team at LSU Health as well for all that they're doing. I'm myself, just like Commissioner Chavez, I see the National Guard here, and I want to thank them first. But it also reminds me of another time in my life when I was fighting another kind of war. And I think back to that team at the time was the U.S. Army, but now I'm so proud of the team that I get to stand and fight with every day. And in recognizing that team, I have to thank LSU Health once again. I have to thank the Caddo Commission We have Dr. Wilson here. I have to thank President Chavez and specifically Commissioners Jackson and Burrell that brought the legislation to the forefront for us to have the mobile testing that we're celebrating today. I also like to thank the City Council. We have Councilman Willie Bradford here with us today, whose district we're in, and his support throughout this. The media, thank you so much for what you do. And we also have Chief Ben Raymond here as well from the Shreveport side. And also from the private side, Mr. Organic, who had his very, very generous donation that's helped our community protect ourselves against this virus. So we're really coming together as a team, and that's something for us to celebrate. Health equity is a serious, serious issue in our community, in our country, and this virus has exposed that gulf more than ever. The gulf between those who have quality healthcare access and those that don't. There are many reasons we have seen COVID clusters form in underserved areas. For starters, some of these urban tracts are 25 times more densely populated than our suburbs. But this is about more than the rate of spread. It is also about the mortality rate in these communities. Sadly, we have lost 93 of our coworkers, our friends, and our family members to this virus. 73% of those have been African American. The state is now providing more localized data on COVID-19 cases, breaking each parish down by the number of cases in each tract. This helps the public better understand why we are seeing a higher mortality rate among African Americans. The areas with the highest concentration of cases are not just densely populated, they also tend to have higher rates of hypertension, obesity, diabetes, and smoking. This is why accessible rapid testing is so important. And not just accessible rapid testing, but again, overall providing quality health care to our citizens. The Shreveport Police Department will assist by providing security for the mobile testing sites. I want to thank the Caddo Commission one more time, Dr. Golly for his leadership at LSU Health and their emerging viral health clinic. I'm so grateful we are able to work together as a community to fulfill this critical need. It is because our teamwork, I know we will be able to overcome this virus. Thank you so much, and at this time, Dr. Whyte will come to the podium.
I just want to reiterate what everyone has said. This is such a tremendous gift for our community that the commission, that LSU, HSC, that Mr. Organic, that all of our city council workers, everybody who came together to make this possible. What a tremendous blessing it is. We know that we have people who feel that they are not able to get the testing that they need. We want to make sure that that need is met. We want people to understand that there is no cost to be tested, that if you have symptoms, if you feel like you're sick, that you need to please make sure you avail yourself of these tests. We need to know who is sick in our community, and I think the viral threat lab is going to really help us to tease out a greater understanding of what is going on in our community. We also have all of our other testing sites still up and running, and we're urging them to continue that process. We want people to know that this is not over yet. While we are seeing improvement, we still need to take this very seriously. We need to understand that this disease could come back in another wave, which could be worse for all of us than the first wave. The mayor just announced, the 93 deaths. We don't want to see double that or greater numbers. We don't even want to see one more death. We want to see people really take this seriously, listen to the guidance that the governor is going to put out. We understand everybody's tired of not being out and about, and everybody needs to get back to work. But let's do it the right way so that we don't have a rebound and have to shut things back down and have a worse situation than we had the first time. Please avail yourself of these mobile testing sites that have been listed. I think it's a great opportunity. We want to know that you are able to get the testing and the medical care that you need. We want you to know that your data is not being used for anything else but just to help you, and that it's not going to cost anything. So like I said, it's very important. You're very important. Your health is very important. This disease It is unlike anything I've ever seen before. I used to do pediatric critical care. I've worked in ICUs. My friends who are ICU docs are telling me this is a very scary disease. If you get it and get well, then you're lucky. If you get it and get really sick, it can be extremely dangerous. So don't take your health for granted. Make sure that you know what you're dealing with and make sure that you get yourself tested. I think that I'm the last one to formally speak. Does anyone have any questions?
Yesterday we was able to distribute 90,000 masks to the community, to the citizens of Shreveport. As I was reporting about the masks and the locations to pick them up, a lot of people were complaining or upset because it was done during working hours, or maybe a lot of locations ran out of masks quickly. Do we have another emergency date time in place where you guys have something left over, or another issue of the mask? Can you speak on that?
Right. So the masks that were provided yesterday as a favor, as an in-kind favor from Haynes Corporation. Those are the people who make our undergarments, and they provided that as a philanthropic effort. And so they only gave us a limited supply. What we did was there was a meeting between the parish and the city to figure out what was the best way to equitably distribute those. And so they were provided on a first come, first served basis. We hope and pray that there will be another philanthropic effort, just like it was mentioned, Mr. Organic. A lot of private sector individuals have stepped up to do good deeds, and so we hope that other good deeds will step up, and hopefully what Haynes did was just the start of people stepping up to donate masks, because I had areas in my district that did not receive, any locations received the mask. And so it was not anything that was arbitrarily done. It was just a matter of resources. And so when you have limited resources to work with, you kind of got to work within those means. And so, we just want everybody to be patient and let them know that our leaders, our mayor, our parish administrator, our parish president, we're working very diligently to ensure that we get resources to everybody in an equitable way.
So just to be accurate, we are out of them.
We are out. We are out of masks, and we'll put out the clarion call for another ask of individuals. We'll even reach out to the Haynes Corporation. I'm sure we have a contact to let them know, once they make some more, if they have some more available, and we will do our best to try to prioritize those areas that may have been skipped over. But I received several of those calls as well, and we are sensitive to that. But again, our hands are tied because it's a supply issue.
Thank you so much.
Any other questions? I'm late, but I'll just kind of take some, discretionary privilege. I know we have a partner here, David Raines, to bring them up. I guess I'm biased to them. But I'll bring our CEO, Mr. Willie Whyte, up to kind of just talk about what they're contributing to the effort as well. And I don't know if we've had an opportunity to recognize our National Guard. I was on the phone with Colonel Lubert this morning. Okay, and they'll be here to assist. They're not here to police, but they are here to assist with traffic flow and things of that nature. And I'd be remiss if I leave the microphone and didn't recognize Dr. Golly and Chris Kelville with the medical school, and Dr. Andrew Urosco. I hope I'm pronouncing that right. They take our phone calls whenever we have questions, and they're being very, very proactive. And I see the police chief here, SPD, so it's an all hands on deck approach to help our community. Not only is this something that we're doing to combat COVID-19, but an effort to reopen our economy. We have casinos shut down, we have businesses closed, tennis courts are closed. If you want to get the tennis court back closed, let's get everybody tested so we can get back to playing golf and just the things that we enjoy. So we want to continue to emphasize social distancing. We want to continue to emphasize staying at home unless you absolutely have to go out. And this effort tomorrow is to make sure we get as many people as tested so we can identify where those hot spots are and be able to contain the virus.
Well, good afternoon, and I want to thank Commissioner Jackson. David Raines Community Health Centers is excited to be able to partner with the Health Sciences Center to bring testing to these underserved communities. It is our goal to test as many persons as we possibly can through this effort, and again, bring care to the community, particularly those who have been historically disadvantaged. And so David Raines Community Health Centers is very excited to partner with LSU and having their mobile unit at our facilities to offer this opportunity for our communities to get testing. Questions? That's it. Well, we look forward to seeing as many people tomorrow from 10 a.m. to 2 p.m. at 1625 David Raines Road, 1625 David Raines Road, David Raines Community Health Center. So we look forward to having you out. You can call and pre-register at 227-3354. That's 227-3354 if you want to pre-register for the screening tomorrow. But we are expecting to take care of all comers. So please come out and take advantage of this opportunity. And once again, thank you to Dr. Ghali and the Health Sciences Center for this opportunity to partner.
If you pre-register, do you get a time, an appointment?
No, you won't need a time of appointment. We will have the registration list at the check-in, and so all you would need to do is check in and then go through the testing procedure.
First come, first served.
Be first come, first serve. Yes.
Are you looking for sick people or well people?
We're looking for anyone who thinks they've been exposed. And so the goal is to identify anyone who believes they've been exposed. If they're having symptoms, certainly to come out and be tested. We also are encouraging persons that if they have a physician or if they want to use David Raines Community Health Centers, if they're having symptoms, you do not have to wait until the testing. You can come to any of our facilities, and we are offering screening and testing at our facilities. So we are encouraging anyone who believes they've been exposed to come out and get tested. Can I answer any other questions?
Underlying conditions.
Underlying conditions. Certainly there are underlying conditions that contribute to the risk factor for COVID-19. If you have underlying medical conditions such as diabetes, heart conditions, other medical conditions, you're at greater risk. And so if you have underlying conditions and you're concerned that you've been exposed, we would encourage you to come out and get tested.
I'm not sure who this question applies to, but what about, I know you guys are trying to stop the spreading of it, but like when we go to certain places to get food, we know there's a lot of the employees of the businesses don't even have on gloves or any type of protective gear, and it's a lot of people inside the restaurants. How do we know about them if they don't have it, or do they have it, and is that a way it can be spreaded or something? Because I noticed it a lot.
Yeah, I would defer that question to Dr. Whyte. I'm not a clinician, so I'll stay in my lane on that. Thank you.
First off, if you see too many people in a place, you can call your police department. They are working with us, the sheriff is as well, to go and speak to these sites if they have too many people and talk to them about really what they should be doing. As far as PPE, gloves and masks are only good for us if we use them correctly. So we're asking people to take off their gloves. So for example, when you see people in the drive-thru and they're using the same pair of gloves for every person that they're dealing with, that's not good, because then they're taking my germs off my credit card on their little fingers, and then they're passing it to the next person when they take that credit card. So what you need to do is make sure that you are cautious. So we're not sure that everybody is always going to do the right thing. So what you need to do is when you hand something to somebody else and take it back, you wash your hands. Hand sanitizer if you can't hand wash, but make sure that you're taking care of yourself. Make sure if you don't have a way to do that, that you keep your hands off your face. If you can do that, you're going to protect yourself until you can wash your hands. We want to help the community and make sure that we're keeping people safe. So if you see something, report it. We're happy to go and take a look and see if we can improve that situation, but also do what you can to keep yourself safe.